My name is Amber and this is my ostomy video. So the first thing I'm going to want to do is wash my hands, introduce myself to the patient. Hi, I'm Amber and I'm going to be your nurse. Can I have your name and date of birth, please?
Rob Jones, 8/25/77.
Okay, and then I'm going to check his wristband and double check. Yep, that is Rob Venebush. Do you have any allergies?
No.
Okay, and then I want to provide some privacy for my patient by closing a door or pulling a curtain, and I'm going to explain the procedure. So today I'm going to be emptying the ostomy bag. Any questions?
No.
Okay. So at this point, I'm going to want to make sure my patient is safe. You feel safe?
Yes.
Okay. So first, we want to check the chart to see when the patient's ostomy surgery was done, and we want to perform a abdominal assessment, making sure there's no pain, no distension. And so after we check for pain and distension, we're going to want to know what kind of stoma the patient has. It could be ascended, transverse, descended, and then we also want to know what type of equipment he has. So after we do that, we want to assess the stoma itself and make sure that it's pink, red, warm, and looks pink, red, and moist, and looks like the inside of a cheek. And so if my patient is mobile, at this point I'm going to want to get him to a bathroom to maintain a sense of normality. But we're going to pretend for a minute that my patient can't go to the bathroom. And so at this point, have you learned how to change or empty your ostomy bag yet?
Yes.
Okay, so if the patient hadn't known how to change his ostomy bag, this is where I could provide education, teach him as we're going, allow him to help me if he wants. We want to make sure that we're changing the ostomy bag before it gets over 1/3 full, because if it gets more than that full, it's heavy, the clip could slide off the bag and it could be a mess. So at this point, we're going to place the absorbent pad on the side of the stoma. In this case, it's over here. We're going to don some gloves. And what we want to check for is around the patient's current wafer, if there's any leakage, if we can see any damaged skin integrity because of the leakage, and his looks perfectly fine, doesn't need replaced. At that point, we are going to put our bedpan and lay our ostomy bag inside of our bedpan. We're going to remove the clip, squeeze the contents of the ostomy bag into our bedpan. We are going to rinse the bag out with some water. We are going to wipe the end of the bag, re-roll it up, and then re-clip it. So after we're done and everything's clean, the patient's good to go, we are going to remove our gloves. We're also going to remove the bedpan, and we're going to want to cover it up as we walk it to the toilet to help with the smell for both the nurse and the patient. And we're going to want to document how much, the color, consistency, or take note of it because we're not documenting yet. And we're going to dump the stool in the toilet and throw the equipment and our gloves away in the appropriate receptacle. And then we're going to come back, we're going to wash our hands and document the procedure. And so that is the changing of or emptying of the ostomy bag. Now what we're going to do is switch cases, and we're going to pretend that our patient not only needs the ostomy bag cleaned, it's been 3 to 7 days, depending on the hospital policy, and the whole equipment needs changed. So like before, we're going to start the procedure. by coming in the room and entering. And I'm going to say, wash my hands and identify my patient. Can you give me your name and date of birth, please?
Rob Jones, 8/25/77.
Okay, and I'm going to check his wristband, and that's who he is. Do you have any allergies?
No.
Okay, at this point, I'm going to provide my patient some privacy. I'm going to explain the procedures, so I'm going to replace the equipment for your ostomy today. Do you have any questions?
No.
Okay. Patient doesn't have any questions. I'm going to make sure the patient is safe and feels safe. Feels safe? Okay. So at this point, we're going to want to, again, take and snap off the bag from the wafer, and it's going to be like a Ziploc bag, and we're going to want to dispose of that. If there's anything in it, we should document what's in it and the consistency. But then what we're going to want to do is assess our patient's abdomen again, make sure there's no distension, no pain. We're also going to assess the stoma, make sure it's pink, red, and moist. And then we are going to start to remove the wafer. And so to remove the wafer, we're going to push down on the patient's skin while pulling up on the wafer to get the adhesive. If it is particularly painful for your patient or you're having trouble removing the wafer, you can use a silicone-based lubricant in order to aid you in removing it. And so once we get the wafer off, we are going to we're going to assess where the wafer was and make sure that there's no fecal matter that was getting through underneath the wafer, no destroyed skin integrity, no signs of infection around the stoma, and we're going to make sure everything looks good, which it does. And so then we're going to go ahead and remove our gloves. We're going to wash our hands and we're going to put new gloves on. At this point, we can cleanse the stoma with water, maybe some soap, but mostly water. And we are going to pat it dry. And then we're going to apply some skin cream around the stoma to protect the skin from the adhesive and fecal matter. And so after we do that, we are going to place some gauze over the stoma because the patient cannot control that. So we want to make sure that if anything comes out, there's some gauze to make sure it doesn't make a mess. And so we are going to want to, again, take our gloves off, wash our hands. We're going to don clean gloves, and we're going to gather our equipment. And this time we're going to need, although I don't have it, a wafer, the bag, and some scissors and a measuring device in order to measure the size of the stoma. And so once we have that and we have our clean gloves on, we are going to take the measuring device and put it over the stoma, and it looks like his stoma is 1.5 inches. So I'm going to take that measuring device onto my wafer. I'm going to trace it, and then I'm going to cut it out. Now I want to make sure that it fits over the stoma, and it does. But here is a little trick that I learned from the video. We're going to want to make sure we cut it 1/8 of an inch larger to provide the stoma room so it doesn't get irritated. And then once we have the right fit, we're going to, after we cut it, we're happy with the size, we are going to remove the adhesive backing from the wafer, and then we're going to put it on the around the patient's stoma. We're going to want to work from the inside out, making sure that absolutely no fecal matter can get underneath of it, or there's no wrinkles, it's not hurting the patient, they're going to be comfortable, and all of that. And so once we do that, we're going to grab our ostomy bag, and instead of taking it off, this time we're going to put it on with its little Ziploc bag, like we're just going to snap it into place. We are going to make sure at the bottom of the bag the clip is on and it's rolled up, and the contents aren't going to leak anywhere. And then we're going to want to do the same thing again. We're going to remove our equipment, our gloves. We're going to dispose of it in the proper receptacles, and then we're going to document the procedure. We want to document things like what kind of colostomy equipment was used, the patient's size, what it looked like prior to changing the bag, what time we changed the bag, and more.